If you've ever spotted between periods or during your luteal phase, this video is for you. I want to talk about intermenstrual bleeding, spotting between periods or during your luteal phase, and what it might mean about your reproductive health. Spotting outside of your regular period can be quite common as a one-off, but it's definitely not something to ignore if it keeps happening over and over. I'm talking about light bleeding, staining, or spotting that shows up randomly in the middle of your cycle, often in the luteal phase, meaning the second half of your menstrual cycle after you've ovulated. There are generally two different causes that I like to investigate when patients complain about this. One is hormonal fluctuations, and two is structural problems with the reproductive tract. When it comes to hormonal changes that can cause this type of spotting, especially in the luteal phase, think low progesterone levels, lower than they're supposed to be after ovulation. Some people even have a dip in their estrogen levels around the time of ovulation that can cause mid-cycle spotting. To investigate some of these hormonal causes, I will always focus on the pituitary. So I will check thyroid function, TSH or thyroid stimulating hormone, as well as another pituitary hormone called prolactin. This can interfere with the brain's ability to send signals to the ovary to appropriately support the luteal phase. I tend to spot check progesterone levels around 1 week after ovulation, and I will tend to supplement for anything under 10 nanograms per milliliter to better support the lining during the luteal phase and prevent it from breaking down. There can also be structural causes. So anything in the inner lining of the uterus, like a polyp or a submucosal fibroid, can definitely cause this type of irregular bleeding throughout the cycle. Even cervical polyps can cause bleeding because they're very vascular and they can get irritated, especially after exams like an ultrasound or after sex. Bleeding can also be a sign of inflammation or even infection in the cervix. And for those who are sexually active, know that sometimes this irregular bleeding can be a symptom or a sign of STIs like chlamydia, so it's important to get tested. And then there's a really common cause of early pregnancy. Spotting can happen around the time of implantation because there's so many blood vessels in the lining of the uterus that can get interrupted as that embryo is implanting and that pregnancy is growing. Here's where you should check in with your doctor if you're having persistent, frequent spotting between periods, if the spotting is new and has changed significantly, and if you're having spotting in conjunction with pelvic pain, unusual discharge, or any sort of discomfort, it's time to see a doctor. If you're trying to get pregnant and you are noticing random spotting throughout your cycle or in your luteal phase, this could be a clue that there's something going on with your hormones or your uterine lining that needs to be fixed. The bottom line is, if you're noting when you're tracking your cycle that your cycle is throwing you curveballs, it's time to get some answers. And in general, that means checking things like a TSH, prolactin, progesterone levels, and then looking at the structure of the uterus. So starting with a pelvic ultrasound, but then assessing the inner cavity of the uterus with very focused specialized tests like a saline sonogram or an HSG to start. It can be very stressful when these unexpected things happen during your cycle, but getting answers is the first step, and there usually is a solution.